Hello learners, today we are going to discuss the congenital heart diseases or heart defects in cardiovascular system. We are on the cardiovascular diseases. On cardiovascular diseases, I would like to inform you all that you have a separate video on common risk factors, common symptoms, common prevention and management, and you have an elaborated video on every disease starting from coronary artery disease, myocardial infarction, angina, hypertension and all. So now we are on congenital heart defect, which is one of the cardiovascular disease. So we will talk about the congenital heart defects. So I welcome you all to the session. Now this in detail we have seen all these videos earlier, and now we are on the last part, that is disorders of the heart. Okay, so congenital heart defects, basically if you will see, what are these defects are nothing but which are present in a person at birth only or usually before birth. That is the reason these are known by the name congenital and heart. So it is related to heart. So these are nothing but congenital heart defects. These can be of two types. A cyanotic congenital heart defects, or cyanosis you can call it as, and other one is cyanosis, that is cyanotic heart defect, congenital heart defects. So what are a cyanosis? As the name suggests, a cyanosis, that means no cyanosis is there, absence of cyanosis, that is like cyanoid you can say, blue coloration. So here there is no feature like blue baby and all, but in cyanosis there is a presence of a blue baby symptom, that is baby will become blue in color because of the cyanoid accumulation. Okay, so what is a cyanosis or what are a cyanotic heart defects, congenital heart defects? So these are the four a cyanotic congenital heart defects, wherein first you can see coarctation of aorta. Coarctation, that is generally, since it is aorta, it deals with the aorta. Okay, and coarctation means there is a specific area which relates to the ductus arteriosus, that to that area specifically. So coarctation is nothing but what I can say, this narrowing of the aorta region, basically in the ductus arteriosus region. Then second acyanotic you have PDA, that is patent ductus arteriosus. So what is these patent ductus arteriosus? Like ductus arteriosus at birth it closes, which is a blood vessel which closes soon after the birth. Okay, and this will have a normal functioning of the heart. That will closure will lead to the separation of the pulmonary trunk and the aorta. But if it does not closes and if it remains open, then again there will be a flow of blood from the high region to the low pressure region, that is from the aorta to the pulmonary trunk. So this condition is nothing but patent ductus arteriosus. Then next cyanotic congenital heart defect is septal defects. So septal defects are basically two types. Atrial septal defect is there and ventricular septal defect is there. Atrial septal defect, as the name suggests, it is something to deal with the atrial septum. So there is something defective in the atria septum. And ventricular septal defect, so there is something defect observed in the ventricular septum. Okay, interventricular septum. So these are the septal defects, and these four are under cyanotic congenital heart defects. And if we'll talk about the cyanosis, that is cyanotic congenital heart defects, it includes the last one, that is tetralogy of Fallot. So as the name suggests, tetralogy. Logy is to study, tetra is 4. So there are 4 defects which are there under tetralogy of Fallot, as you can see in the label. Stenosed pulmonary valve, valve stenosis, okay, pulmonary valve stenosis. Then interventricular septal defect, okay. Then again you have enlarged right ventricle, that is hypertrophied, okay. Then basically, if you will see, myocardium is thick in left ventricle, not in right ventricle, but you have hypertrophy of right ventricle, that is nothing but enlarged muscular layer of the right ventricle. Then the last one is this aorta, which is emerging from both the ventricles. This is again because of the interventricular septal defect. Okay, so this tetralogy of Fallot we will see in detail. We will start now one by one. The very first is coarctation of aorta. So now aorta is what? Aorta, as you can see, this one is the aorta, which is the largest blood vessel of the body. And since this is aorta, okay, it carries the purified blood, that is oxygenated blood. Okay, so this oxygenated blood is being carried to the body. So what will happen here now? Coarctation means what? This is the condition wherein a particular segment of aorta, that too basically most oftenly, which is located near a blood vessel called ductus arteriosus, in this area the aorta will become too narrow. Okay, so because of too narrowing of this aorta, as you can see here, the blood which is flowing, this will be restricted and the flow of oxygenated blood to the body is reduced, since the aorta is supplying the blood to the body. So left ventricle needs to pump harder and high blood pressure will develop in the aorta. So this is the condition which is coarctation of aorta. And what is the remedy for this coarctation of aorta? We will see simultaneously. This is usually repaired surgically by removing an area of obstruction and may require revision in adulthood. We can remove the area of obstruction, or we can go for some surgical procedure like in this earlier video we have seen in this diagnosis. Okay, under diagnosis as well as under treatment we have seen that coronary angiography is basically done to detect, and angioplasty is the surgical procedure. So with this in angioplasty there are various types which we have seen. Balloon dilation is there, okay, stenting is there, coated stents are being applied. So balloon dilation is basically done that through this artery, the balloon like on a stent, a balloon will be projected, and that is inflated when it reaches to this narrow area, and the inflation of this balloon will stretch these walls of the vessel, and there will be again regaining of the shape. That means जो narrow portion था, now it will become wider. Okay, and the blood will flow as usual. Okay, so this balloon can be inflated, the vessel will regain its structure, and again this will be removed. Or else the balloon, on that balloon one metal stent is projected, which is made up of metal, and that stent is to be inserted into that blood vessel, and it is basically left over in that vessel only, which will keep the vessel in dilated condition or normal shape, which will not restrict the flow of the blood. Okay, and the vessel will remain open. So these are the remedies for this coarctation of aorta. Next is patent ductus arteriosus. As the name suggests, ductus arteriosus, it is something to deal with the ductus arteriosus. So what happens generally? Soon after the birth, this ductus arteriosus, which is a temporary blood vessel, which is a connecting link between the aorta and this pulmonary trunk, this shunts soon after the birth. But if it remains open even after the birth, okay, even if it is not closing soon after the birth, it will result in the condition wherein the aortic blood, as you can see here the arrow, the aortic blood will flow into the pulmonary trunk, and the pressure in the pulmonary trunk will rise, and again eventually it will increase the overworking of both the ventricle. Why? because left ventricle is giving the blood to the aorta. सो एओर्टा से ब्लड अगर यहाँ पे जा रहा है, बॉडी को भी एओर्टा ब्लड दे रहा है, एंड पल्मोनरी ट्रंक में भी अगर ये जा रहा है, तो डेफिनेटली लेफ्ट वेंट्रिकल नीड्स टू वर्क हार्डर, एंड पल्मोनरी में भी अगर ब्लड ऑलरेडी दिस इज गिविंग, एंड अलॉन्ग विथ दैट इफ इट इज प्रोवाइडिंग द ब्लड, देन अगेन द प्रेशर ऑन द राइट ventricle also increases. Okay, so this is something which happens in the patent ductus arteriosus. Okay, but this can be minimized. So what is the remedy now? We can go for the closure of this defect through the surgical procedures, and some medications can be used, but in severe cases we will basically go for surgical procedures. Okay, wherein this condition is treated surgically by the cardiac catheterization or surgery. Okay, so this is patent ductus arteriosus. Then the next we will talk about the septal defects. Septal defects are of two types: atrial septal defects and ventricular septal defects. So atrial septal defects, as the name suggests, it is something to deal with the atria, and ventricular are something to deal with the ventricle. So what happens here? The septal defects. Septal defects क्या होता है? मतलब ये जो septum होता है, which is separating the two ventricles and the two atriums, this septum is defective. Okay, so the name septal defect. So क्या होता है? In this septum there remains an opening. Okay, so ये opening के वजह से again there are chances of mixing of blood. So what happens in atrial septal defects? Foramen ovale जो होता है between the two atrias, it soon closes after the birth and develops into the fossa ovalis, which is a oval depression, which is the closure between the two atrias. Okay, but if this fails, okay, the foramen ovale जो होता है, if it fails to close, then there remains a defect in the septum, which will cause the mixing of the oxygenated and the deoxygenated blood between the two atrias. So this is atrial septal defect. And ventricular septal defect में क्या होता है? This is either due to incomplete development of interventricular septum, so because of which again there remains a gap, and again there is a mixing of blood. So because of this mixing of blood, okay, between the two atrias and between the two ventricle, oxygenated and deoxygenated blood mixing will arise. So atrial septal defect, as you can see here, see, the blood from the left ventricle is going to the right, the blood from the left atrium is coming to the right atrium. Okay, so this is atrial septal defect, which is a hole in the septum between the two upper chambers, that is atria. Because of this hole, as this hole increases, the amount of blood that is flowing through the lungs, again it will flow. Okay, the hole increases the amount of blood that flows through the lungs. Like since here the blood flow will increase, the increased amount of blood will be given to the lungs through the pulmonary trunk. Okay, so through the pulmonary trunk. So this is something which is atrial septal defect. So it can also be again recovered through a surgery, or device closure might be necessary to repair the atrial septal defect. Okay, this can be closed with the help of surgery. Okay, but if it is a large hole, okay, then it causes the extra blood to overfill the lungs and overwork the right ventricle or the right side of the heart, along with that overworking of the lungs. Okay, so pressure in both lungs as well as on the heart right side increases, because of which eventually it leads to pulmonary hypertension too. Okay, then these are several types of atrial septal defects. If you will see, there are 4 types of atrial septal defects. Okay, in the diagram which you can observe. Okay, so what is this? Upper region, middle region and the lower region. So यहाँ पे क्या होता है? Secundum, primum and sinus venosus. Okay, तो अगर डायग्राम में तुम लोग देखते हो, it is upper sinus venosus. यहाँ पे क्या होता है? This is जो सेप्टम होता है एट्रियल सेप्टम, उसके अपर पार्ट में अगर डिफेक्ट है, सी दिस इज द सेप्टम, ओके, अपर पार्ट में डिफेक्ट हो सकता है, मिडल पार्ट में डिफेक्ट हो सकता है, या फिर लोअर पार्ट में डिफेक्ट हो सकता है. अगर ये डिफेक्ट अपर पार्ट में है सेप्टम के, तो इट इज नोन बाय द नेम साइनस विनोसस. ओके, it usually occurs in the upper part of the atrial septum and it is associated with the other congenital heart problems. Okay, primum क्या होता है? अपर रीजन में साइनस विनोसस है, लोअर रीजन में प्राइमम है. प्राइमम एज इट इज इन द लोअर पार्ट ऑफ द एट्रियल सेप्टम. ओके, एंड सेकेंडम क्या होता है? इट इज इन द मिडल layer, okay, middle of the wall between the atria, that means middle of the septum. And what is coronary sinus then? Coronary sinus में क्या होता है? This is a rare defect wherein the part of the wall between the coronary sinus, which is the part of the vein system of the heart, and the left atrium is missing. Like एक part होता है जिसमें coronary sinus क्या होता है? जो कोरोनरी सल्कस है उसमें जो ब्लड वेसल होता है, दैट इज कोरोनरी साइनस. ओके, दिस यू कैन सी हियर. ओके, कोरोनरी सल्कस में जो ब्लड वेसल्स है, दिस ब्लूइश कलर्ड पार्ट, ओके, ऑन द हार्ट, दिस ब्लूइश कलर, एंड इसका कुछ पार्ट, एंड द लेफ्ट एट्रियम विच इज देयर, इसका कुछ पार्ट, बोथ द पार्ट्स आर मिसिंग. सो दिस इज कोरोनरी साइनस डिफेक्ट. ओके, बट इट इज रेयर डिफेक्ट. Next is ventricular septal defect. Again, as the name suggests, ventricular, there is hole in the ventricular septum which will allow the passage of blood from the left side to the right side of the heart. And again, the oxygen rich blood will go to the lungs through the pulmonary trunk. Okay, so this is the ventricular septal defect. A small ventricular septal defect may cause no issues, but a medium or a larger ventricular septal defect, as you can see here, it needs a surgery and it needs a repair in this septum or the closure of this septum, through which we can separate again the ventricular blood. Okay, right and the left ventricular blood. Next is tetralogy of Fallot, which is remembered by this mnemonic PROV. Okay, what is PROV? P for pulmonary stenosis, R for right ventricular hypertrophy, O for overriding aorta, and V for ventricular septal defect. So these is nothing but tetralogy of Fallot. P for pulmonary stenosis, R for right ventricular hypertrophy, O for overriding aorta, and V for ventricular septal defect. Okay, so this is nothing but, this is something which is, first of all you need to remember, it is a cyanotic congenital heart defect. Means what happens, this is a combination, I will tell you later. Okay, this is the combination of 4 developmental defects. कौन से? These are PROV. Okay, so यहाँ पे क्या होता है, there is a decreased flow of blood to the lungs and the mixing of the blood from both the sides of the heart. So because of the mixing of the oxygenated and deoxygenated blood in high amount, this causes cyanosis, that is bluish discoloration. और कहाँ पे होता है bluish discoloration? Mucous membrane में, nail beds में बेबी के. ओके, कब होता है? When the level of deoxygenated hemoglobin is high compared to the oxygenated. This condition in babies is referred to as a blue baby. Okay, but despite the apparent complexity, this condition can also be recovered through the surgeries. Okay, so ये क्या है? As the name suggests, pulmonary stenosis is nothing but stiffening of the pulmonary valves. Okay, then ventricular septal defects, as we have learned, ventricular septal defects, there is a hole in the interventricular septum. Then right ventricular hypertrophy is nothing but abnormal thickening of the right ventricle, which is usually very thin compared to the left ventricle. Okay, then overriding aorta. Why overriding aorta? Because this deoxygenated blood and the oxygenated blood, because of the mixing, and again, because of the pulmonary stenosis, high amount of mixed blood will go to the aorta and eventually it will go to the body, and again cyanosis will arise. Okay, that means blood cannot enter more from the pulmonary trunk to the lungs because of the pulmonary stenosis. So overload will come on the aorta and the mixed blood will flow from the aorta and it will go to whole blood body, because of which the blue coloration of the baby, so blue baby condition will arise, that is cyanosis. So this is nothing but tetralogy of Fallot. So this is very nicely represented in this diagram which I have got online. Okay, like the very first, if you will see P, that is pulmonary stenosis, that is narrowing or stiffening of the pulmonary valve, because of which restriction for the blood flow through the pulmonary trunk. Then R is right ventricular hypertrophy. So see this boot, okay, boot shaped heart, hypertrophy. See, these are the hills. Okay, compared to this, that means what? Compared to the left ventricle. Okay, left ventricle generally thicken होता है, but यहाँ पे क्या है, राइट वेंट्रिकल थिक हो गया है, राइट वेंट्रिकल का मायोकार्डियम लेयर. सो यहाँ पे हील से रिप्रेजेंट किया है बूट के इसको. सो दिस इज राइट वेंट्रिकुलर हाइपरट्रोफी. ओके, अगेन आर हो गया. अभी ओ इज फॉर ओवर राइडिंग एओर्टा, because of this pulmonary stenosis, again the aorta will override. Okay, and the load will come on the aorta. Okay, and then the last is ventricular septal defect. Okay, ventricular septal defect is nothing but, as you can see, this is represented with the hole. Okay, that there is a hole in the interventricular septum which will cause the mixing of the blood, and high amount of blood will flow through the aorta and ultimately to the body. So this is a very nice diagrammatic representation of the tetralogy of Fallot, which will help you to remember it throughout your life. You will not forget the tetralogy of Fallot. Okay, so with this we finish with the congenital heart defects. Thank you, and stay tuned with us for the another videos on the same cardiovascular system and various other subjects topic. You can visit our website www.pharmacyinfoline.com for the free access to the notes and other materials on the pharma, as well as you can visit to our YouTube channel wherein you have the paid membership with the join button, as well as you have the free access to various videos of MCQs and the theory. Thank you.